After watching this video, you're gonna take gum disease a little bit more seriously. I'm gonna show you why if something goes wrong in your mouth, how it can affect the rest of your body. So here are 7 other diseases that you can get from gum disease. Number 1 is cardiovascular disease. So research shows that there's a link between gum disease and heart disease, getting a stroke, and other cardiovascular problems. It's thought that the inflammation and bacteria you get in gum disease actually spreads into your bloodstream and works its way to your heart. So this cohort study involving 1,147 men measured bone loss and probing depth pocket scores. So basically, this is when you go to the dentist or the hygienist and they do that probing around your gums and they're shouting out that number to their assistant. Basically what this is a measurement of how deep those pockets are around your gums. Because your gums aren't just glued to all your teeth. There's actually something called a sulcus, which is basically this pocket. And if that pocket gets too deep, then that is a clear indicator that you have gum disease. So these pockets are measured in millimeters. So ideally, these pockets are between 1 and 3 millimeters deep. If they start going beyond that 3 millimeters, that's when you start to get worried about gum disease. And the bigger that number is, the worse it is. This study found that those who had higher scores on these probing depths had a higher risk of getting heart disease or a stroke. The thing is, when you get this gum disease, you get a lot of these nasty gram-negative bacteria that start to go underneath your gums. And these bacteria can lead to chronic infections in your gums. And these infections don't just stay in your mouth. These bacteria will spread to the rest of your body. And this can eventually lead to plaques and clots that build up in your arteries and start to affect your heart. Now, number 2 is diabetes. One of the most clear links we have with gum disease in the rest of your body is diabetes. So studies show that gum disease can make it more difficult for people with diabetes to control their blood sugar levels, but also the worse people's diabetes is, it actually makes it harder for them to control their gum disease. So this analysis found that periodontal therapy resulted in a modest reduction in people's HbA1c levels, or in other words, their glycated hemoglobin levels. Now this is basically a test to see whether or not someone has diabetes. So if this HbA1c number is too high, that means that they are diagnosed with diabetes. Now what the study also mentioned was their HbA1c was measured about 3 to 4 months after periodontal treatment. But when it got closer to 6 months, then their HbA1c levels went back up. Now the thing is, when you have active periodontal disease, you need to go to the dentist at least every 3 to 4 months at first to get it in a stable condition. Because once that disease is no longer active, then you can start going to the dentist less frequently, like every 6 months, like a normal person. But because that disease is actually active at first and it's not controlled, that's when you need to go more regularly than normal to keep that disease under control. And then once your own body can take over from there and those gums start to tighten up, then you don't have to go as often. Now, number 3 is respiratory infections. So this systematic review is looking at relationships between periodontal disease and lung diseases like pneumonia and COPD. What they found is bacteria that comes from gum disease can actually be inhaled, and this is how it can start to affect your lungs. They also found that poor oral hygiene and periodontal disease may facilitate the colonization of respiratory pathogens in the oropharyngeal region. Basically, as you inhale these bacteria, then they can start to colonize in your throat area, and this is how it can lead to diseases like pneumonia. Also, they found that oral interventions to actually improve oral hygiene have reduced people's risk of pneumonia by an average of 40%. Now, number 4 is rheumatoid arthritis. Rheumatoid arthritis is basically an autoimmune disease that affects your joints. It's thought that this systemic inflammation that you get from gum disease can actually worsen the inflammation in your joints. And this is how it can contribute to the development of rheumatoid arthritis. So this article actually suggests that periodontitis might trigger and sustain the autoimmune response characteristic for rheumatoid arthritis, meaning it is also a modifiable risk factor for rheumatoid arthritis. So the more risk factors that someone has for a disease, the more likely they are to actually get that disease. So if you eliminate as much of these risk factors that you can, like these modifiable risk factors like periodontal disease, then that actually lowers your risk a lot from getting that disease. Now, at the same time, the opposite holds true. So people who already have rheumatoid arthritis are at a higher risk now of getting periodontal disease. Now, number 5 is pregnancy complications. So women who are pregnant and have gum disease have a higher risk of having pregnancy complications, like preterm birth or having low birth weight. And the other thing during pregnancy to note is you get a lot of hormonal changes when you're pregnant. And this also affects your gums. There's actually a condition called pregnancy gingivitis. And the reason is that since your hormones are thrown off, then you can get more inflammation in your gums. So it's actually even more important when you're pregnant to be on top of your oral hygiene. So this study actually found that getting a dental prophylaxis, which is a dental cleaning, and periodontal therapy, which is basically a deep cleaning, may significantly reduce the risk of preterm birth and low birth weights. Specifically, these reductions were a 50% reduction in preterm low birth weight and a 50% reduction in preterm births. Now, number 6 is cognitive decline. Something that we're picking up now is that brushing and flossing can actually lower systemic inflammation, because when you brush and floss, then you lower the bacterial load in your mouth and you lower the need for inflammation to build up in your mouth. Now, there's also a link between gum disease and Alzheimer's disease. Now, specifically, this microbe that causes gum disease, called P. gingivalis, has also been found in the brains of people with Alzheimer's disease. Now, this P. gingivalis is also what causes this higher level of inflammatory biomarkers and leads to this systemic inflammation. Now, does that mean that gum disease causes Alzheimer's? Well, we don't know yet. But the risk is just too high to avoid keeping your teeth and gums clean. This was a 6-month observational study of 60 people with mild to moderate Alzheimer's disease. So they had a cognitive test performed, they had blood samples to assess their systemic inflammation, and they also had their gums examined by a dental hygienist. Then they had these tests repeated 6 months later. So they found that the presence of having gum disease at this initial screening was not related to their initial cognitive state. But having that gum disease was associated with a 6-fold increase in the rate of cognitive decline over that 6-month follow-up period. So this suggests that if you have uncontrolled gum disease, that this can accelerate your cognitive decline in your Alzheimer's disease a lot quicker than if your mouth is simply healthy. Now, number 7 and the last disease on my list is cancer. So in a study published in the Journal of the National Cancer Institute, they looked at data from dental exams performed on 7,466 patients. And they followed these patients from the 1990s until 2012. And they found a 24% increase in the risk of getting cancer when participants had severe periodontitis, or in other words, severe gum disease, compared to those with mild to no periodontitis. And the highest specific types of cancer that was observed was lung cancer, followed by colorectal cancer. Now, I'm sure no one denies that brushing and flossing is important, but I'm hoping that after watching this video, you'll put it at a higher priority than whatever you're doing right now. And I'm hoping you'll also be going to your dentist every 6 months to make sure that your gums and your teeth are in check. Because it's not just gum disease you have to worry about either. It's also your teeth. If you have a giant dental cavity, this can lead to a dental infection. And again, this infection can spread to the rest of your body. You can have an infection that spreads to your lymph nodes that eventually cuts off your breathing because your throat swells up. Or you can have an infection that eventually spreads to your brain. And both of these things can kill you. So in other words, don't avoid your oral hygiene and don't avoid the dentist. Is it actually possible to prevent Alzheimer's disease and other neurodegenerative diseases, or is that just a lie? Well, most people would tell you no, that there's no way of avoiding it, but that's really not the case anymore. So newer evidence has come out and we've found ways that you can not only slow down Alzheimer's, but potentially prevent it altogether. So researchers